Hello. With a heavy heart, I have to continue to present the update on COVID in India. Uh, some of you who are close to me in the circles have come to know that we in our family lost two close relatives. Uh, one, Sheila's own brother, my wife's, that is my brother in law, and then my sister's brother in law. Both went to be with the Lord, but that's not due to COVID. But we are in a situation which is so, uh, because of COVID, both the men's only daughter, one from America, one from England, supposed to go for the funeral. And because of COVID lockdown, they were not allowed. So to go and they have to just watch in their service on online. So the condition in India, when you actually look at it, it goes like this. You look at this, the third wave coronavirus, inevitable. We need to be prepared, says government, that is Indian government. And the Home Ministry has asked states and union territories to conduct a detailed review of first fire safety mechanisms at hospitals and nursing homes, a move that follows several instances of fire and healthcare facilities in various parts of the country. So, okay, this is happening in one side, but look at this news, which is so horrible. In COVID hit India, a 26-year-old doctor decides who lives and who dies. Can you believe that? A 26-year-old, and he not even has finished his um, medical degree totally. But look at the uh, statement he has made. At New Delhi, Rohan Agarwal is 26 years old. He doesn't even complete his medical training until next year. And yet at one of the best hospitals in India, he is the doctor who decide who will live and who will die when patients come to him gasping for breath, their family members begging for mercy. So the pressure is so much upon him. And so he, as India's healthcare system teeters on the verge of collapse during a brutal second wave of the novel coronavirus, Agarwal makes those decisions during a 27-hour workday that includes a grim overnight staff shift in charge of the emergency room at his New Delhi hospital. Everyone at Holy Family Hospital, sorry about this, because I was asking for a list of people who got affected. I thought that had come on the way. So anyway, Agarwal makes those decisions during a 27-hour workday that includes a grim overnight shift in charge of the emergency room at his New Delhi hospital. Everyone at Holy Family Hospital, patients, relatives, and staff know there aren't enough beds, not enough oxygen or ventilators to keep everyone who arrives at the hospital's front gates alive. Who to be saved, who not to be saved should be decided by God, he agrees. But we are not made for that. We are just humans. But at this point of time, we are being made to do this. So he just looks at the cases which are going to go, he allows them to die, and which are going to remain, he says they can be there. And some of the clips, just 2 minutes watch, beloved, you can watch this.
This is the checkers game where grandson and granddad will bond. This is me, Jessica, here in the Bay Area and across California, across the country, really. Every day I chat with my parents and relatives just to kind of find out, okay, who over there has been infected, and it's usually someone we know. My relatives also over in India right now, they don't leave the house. They are confined to their homes or their apartments. They only go if they have to go to the office or to get groceries. So what happened here? Where were the missteps we talked about in India? Well, a few months ago, the Indian government thought they had COVID-B, so they weren't really pressing people to get vaccinations, and also they were allowing a lot of outdoor gatherings and gatherings of all kinds without people wearing masks. And sadly, that now India is paying the price. The latest numbers, about 7 million reported infections in India in the last month and 57,000 deaths. That's about 80 deaths per hour. And these numbers are just the reported cases. There are likely many more deaths and infections in rural areas and those slums of Delhi and Mumbai. I spoke with my cousin, who's a dentist in Mumbai.
Almost everyone knows someone, either within their homes or within their buildings, their colonies, their work colleagues, their friend circle, who's either had this and has recovered from it, or who has had this and has long COVID where they're still dealing with some symptoms, or who has had this and hasn't recovered from it. It's been a challenging time.
Preeti, are you upset? Are you mad? Are you fearful? What are the emotions that come to your mind just right now as this country, your country, battles through this?
I think right now the only thing to do is to look ahead, to learn from the mistakes. And when I say mistakes, it's simply, I think, lack of preparedness. We didn't anticipate a second wave coming in so quickly, so swiftly, being so infectious. And so systems and help that should have been in place wasn't in place. So I think it helps to just look forward, see how we can flatten the curve as quickly as possible, learn from these mistakes so that if there is, God forbid, a third wave, that we're far better prepared at that time.
We can certainly learn a lot from what's happening in India. In his news conference today, by the way, President Biden said he talked with Indian Prime Minister Narendra Modi. The president said the U.S. is actively sending supplies and oxygen, which is so desperately needed in India. Before we wrap it up, getting back to my cousin Preeti, she said her 2 kids, and I can relate.
So this is how, beloved, the condition is in India. And we're all being affected, as the newsreader was mentioning, Raj Mathai, that somebody or the other in your close family or in your close church network, it's horrible to understand all this. So we are trying continuously to help at this moment. Or so even a small gift, an appeal I'm continuing to make, a gift of $10 per person will provide basic needs to protect our widows, old men and women. We can give them mask, sanitizer, hand wash with soap, few ingredients. Today I put all those ingredients which they can supply: lemon, tulsi, amla, pepper, turmeric, and vitamin D. They can boil the ingredients and inhale the vapor, which is found to be to some extent effective. So some donations were coming in. So we have now 82 families covered so far. And our children report will be, our report from the children whom we have supported will come soon. If you provide $20 per person, we'd be able to give for a month groceries. So please rush your gifts to Global Mercy Foundation. I have given the address. You can always stop this clip and look at the address, or globalmercyfoundation.com, and go to the donate button and do the things. May God bless you as we will continue to bear one another's burden. May the Lord bless you.